Hey everyone, thanks for joining me. Today we're going to talk about C. diff infection. The scoop on poop. Is your diarrhea caused by C. diff? Well, in order to answer that question, you need to understand C. diff. C. diff is a bacterial infection, and we'll go through colonization versus infection, the risk factors of infection, the symptoms, testing, infection control, and the treatment. C. diff is one of the most common healthcare associated infection. Some strains of C. diff can be friendly. They can be part of colonization or part of your own intestinal microbiome. And other strains can produce toxins that cause C. diff. This bacterium can form spores and they can survive for a long time on surfaces, and these spores can be resistant to alcohol. And C. diff infection can actually result when you disrupt the intestinal microbiome. If you have toxigenic C. diff present, it can multiply and form a toxin. So if you have good and bad bacteria living with you, the normal bacteria are keeping the C. diff in check. And then if you're given antibiotics, you decrease the good bacteria and the C. diff can overmultiply. And when they do this, if it has toxin, it can produce a problem with infection. This shows the normal microbiota here, and then when you take antibiotics, you end up killing off a lot of good bacteria. Well, this allows the C. diff spores to germinate and form toxin. You can end up with infection, and then if that infection is treated, you can restore your normal microbiome, but unfortunately, about 20% of people will end up with a recurrent problem with C. diff. What are your risk factors for C. diff? Well, antibiotics are the most important risk factor because most cases of C. diff occur while on antibiotics or within a few months after taking antibiotics. Age, also recent hospitalization or stay at a long-term care facility, a weakened immune system such as cancer, chemotherapy, or other immunosuppressive medications, and a prior infection of C. diff increases your risk. Gastric acid suppression like proton pump inhibitors or H2 blockers. This is an association. There's no evidence that stopping these medications will improve C. diff, but it is recommended, just like with any medication, if you're on this, reassess it. Ask yourself, do you really need it? Talk to your doctor. Consider stopping it. Symptoms of C. diff can be very mild or severe. You can have mild, just a few watery or loose stools a day, or you can have nausea and vomiting, abdominal pain, and fever with that. Or you can have severe symptoms with severe abdominal pain and illness requiring hospitalization, and rarely end up with sepsis in the ICU and possibly even require colon resection and rarely even death. So a wide spectrum of disease is possible. Should you get tested for C. diff? The answer is no, only if you have clinical disease, which is diarrhea. We don't want to know if that C. diff is living with you or if you are colonized. We don't treat colonization. Why? Because exposure to more antibiotics will kill bacteria living with you and will also create more problems and likelihood of those bacteria becoming resistant. So only test for C. diff if you have new unexplained diarrhea, more than 3 loose stools or watery stools in a 24-hour period. Your stool should not be formed. If you have formed stools, you don't have C. diff. Other possibilities of diarrhea should be ruled out. Like, for example, did you start a stool softener? Are you taking a laxative? Were new tube feeds started? There are very, very rare scenarios, and this would be somebody hospitalized on the brink of death or with serious C. diff infection, where they would have such severe disease that they would have colonic blockage, where you might not see as much diarrhea, but that is very rare. So what are the problems with the C. diff testing? The problem is no test will tell you if you're colonized or if you have a true infection. So you should only be tested if you're having diarrhea. There are different testing protocols. This PCR test look for genes or DNA that code for the toxins. They don't tell you if the C. diff is actively producing toxin, and they may detect colonization where you just have no symptoms and it's just living with you. The EIA or two-step testing method is a bit more predictive of true disease, but it still doesn't differentiate colonization from infection. It tests for this GDH antigen and also the toxin antigen. Now, it's important if your doctor wants you to submit a stool sample. Yes, you have to submit poop or feces or stool, whatever you want to call it, to your doctor or to the laboratory. If you're doing this at home, ensure that you keep this refrigerated until it's time to transport your specimen to the lab. And again, only get tested if you have symptoms. So define C. diff infection: new, unexplained, persistent diarrhea with a positive C. diff test, or it can be diagnosed by what's called pseudomembranous colitis if somebody scopes you or they take some tissue and do pathology. In regards to infection control, it is contagious. How is it contagious? Well, it's found in the poop. It can live on surfaces, and the spores can survive on surfaces, so it's transmitted by the fecal or from poop to mouth route. So if somebody uses a bathroom and doesn't wash their hands properly, they can take that C. diff and spread it all around the environment, and then if you touch the environment and then don't wash your hands and put it in your mouth, you can end up getting the C. diff inside of you. So washing hands is critical. Wash with soap and water is recommended. Some data indicates that, at least in a test tube, spores are not killed by alcohol. Always, always wash your hands before eating. What's the treatment of C. diff? Well, try to stop the current antibiotic or change to a new antibiotic if you can. For the initial C. diff infection, it's treated with this oral fidaxomicin or oral vancomycin. Very mild cases, your doctor may decide to treat with metronidazole or flagyl. If you're unable to stop the antibiotic, some experts, depending upon the situation, might consider extending the C. diff treatment for about 1 week beyond your antibiotic stop date. If there's a high risk of recurrence, like an immunosuppressed patient or a first recurrent C. diff infection, then we do what's called the pulse taper of fidaxomicin or vancomycin. We'll talk about that in a minute. Or if you were initially treated with metronidazole, they may opt to treat you with oral vancomycin. An additional consideration is a bezilotoxumab infusion. It's a monoclonal antibody. It requires an IV infusion. There are risks and benefits to everyone. This is not, or to everything. This is not recommended for everyone, and you need to look at the risk and benefit of that infusion. If you have a second or continuous recurrences, which some people do have, it's again treated with this pulse taper of fidaxomicin or vancomycin. You treat for the regular 10 days, but then depending upon the antibiotic that's used, for fidaxomicin, you get 1 pill every 48 hours. After that, for 20 days, for vancomycin, you break it up, and what you're doing is going off of the antibiotic and then allowing any spores to germinate, and then so you can kill it with the antibiotic again. Because the recurrence of the C. diff is likely because you have spores in there that can regerminate when you're off the antibiotic. So this is very rare. We don't do this with really any other infection where we treat with intermittent dosing like that to try to kill these spores. Another method is vancomycin followed by rifaximin, and then this consideration of the IV bezilotoxumab. That infusion is given in addition to the treatment therapy. Now, if this is continuing to be a recurrence and very difficult to rid, some patients may benefit. It's been shown again and again from fecal microbiota transplant, especially if it's, like I said, difficult to control. So you won't need to know this. The treatment of very severe C. diff patients would be in the hospital. It's with vancomycin at an increased dose, and then the flagyl by IV or metronidazole by IV. And if patients aren't able to have diarrhea because they're severely critically ill, they might need to have vancomycin instilled rectally. So once you're treated, do not ask for, and hopefully your doctor's smart enough to know not to test for cure of this, because most patients will continue to have toxigenic C. diff present in the stools. So we follow clinically. If your diarrhea resolves, fine. We don't test it, we don't look for it, we don't retreat it. That's it, you're done. Like we talked about, some people can have recurrence though, and in those cases we do retreat. And oftentimes are recommended to use that pulse taper like we talked about. So again, the test could remain positive, yet clinical disease be resolved. We don't want to give you any unnecessary antibiotics. To think that we're going to, quote, sterilize your colon from anything is ridiculous. Now, I can't leave this talk without talking a little bit about probiotics. There's controversies with this treatment. There are reports of probiotics decreasing the risk of C. diff infection or improving it during C. diff infection. Improving the C. diff infection, I should say. But there's also reports of severe infections involving bacteria and yeast that are in these probiotics. And some of these can be very difficult to treat. So at this time, I cannot recommend for or against the use of probiotics. I certainly would not use them if you're immunosuppressed or if there's a risk of colon perforation. And see a subsequent talk where I'll go into more details about the fecal microbiota transplant and probiotics. So 3 top tips to prevent C. diff infection. And these are also going to be the tips that will tell you what your likelihood of infection is. If you don't have a lot of risk, you're not likely to have diarrhea from C. diff. 3 top tips: only take antibiotics if you absolutely need them. Don't expect an antibiotic for viral infections like common cold or flu. Now be cautious when you're in a healthcare environment. C. diff could be on surfaces. It could be transmitted around by healthcare personnel. That's why washing hands is important. And if someone comes into your room and they start touching you and everything in your room and you don't see them wash their hands, ask them about it. And always, always wash your hands before eating. And of course, it goes without saying to wash your hands after using the restroom. Now, if you haven't received antibiotics in the past 3 months or you haven't been hospitalized in a healthcare facility of some form or a nursing home, your likelihood of having C. diff is going to be exceedingly low. So, is your diarrhea from C. diff? Answer: not likely if you don't have the risk factors. Here are some selected references. Thanks for joining me today. And please like my video and subscribe. It really helps my channel. Have a good day.